The real path to becoming a surgeon after MBBS. It is 2:17 in the morning. The operation theater's red light is on, outside a family silently stares at the wall, and inside a junior doctor feels the true weight of medicine for the very first time. The senior surgeon says just one word, scalpel. In that single moment, thousands of pages of textbooks, NEET nights, hostel exhaustion, and the patient's heartbeat all come together and stand at one place. But the biggest fear here is that even after completing MBBS, nobody directly becomes a surgeon. There is certainly surgery in the name, but the right to hold a knife in your hand comes from training. So then what is the real path? Is it necessary to do an MS after MBBS? Will a DNB work? Or is MCH the final gate to becoming a big surgeon? The story begins in a 12th grade classroom. A student is sitting with PCB. The family is saying they have to become a doctor, but right now they don't know how long the distance is between a doctor and a surgeon. Physics, chemistry, and biology don't remain just subjects anymore. They become the first gate of that race, where every single mark can change the future college exposure and confidence. In India, the main national route for MBBS admission is NEET UG. This very exam makes lakhs of students stand before a single question: who will reach the medical seat? After qualifying NEET comes counseling. Government college, private college, AIQ, state quota, fees, bonds, location, every choice changes the mood of the student's journey. Then MBBS begins, a long journey of about 5.5 years. This includes around 4.5 years of academic training and 1 year of compulsory rotatory internship. In the first year, standing in front of a cadaver in the anatomy hall, the student looks at the human body not as a book, but as reality for the first time. This is the first silent shock of becoming a surgeon. Physiology explains the body's rhythm, biochemistry the inner chemistry, pathology the pattern of disease, pharmacology the logic of medicines, and microbiology opens up the invisible world of infection. Then clinical postings begin. The patient is right there in the ward, history needs to be taken, examination has to be done, and for the first time you realize that a disease isn't just a chapter. But here is the pattern interrupt. Surgery as a subject is taught in MBBS, operations are observed, names of instruments are learned, yet an MBBS graduate is not a full surgeon. In internship, the student goes through emergency, medicine, surgery, gynecology, pediatrics, and community postings. Here, duty doesn't mean attendance, it becomes responsibility. After completing internship, registration is required. You get the legal identity of being called a doctor, but the story of a surgeon still remains incomplete. This is where the first big twist comes. After MBBS, the student has become a doctor, but if they want an independent surgical career in the operation theater, they need postgraduate surgical training. In today's current system, NEET PG is a very crucial route for broad specialty surgical seats. Entry into MS, MD, PG diploma and DNB broad specialty courses comes through this very score. Some institutes of national importance, like AIIMs and JIPMER, keep the INI-CET route for PG courses. Therefore, a serious aspirant doesn't just need one exam, they have to understand the entire admission map. MS General Surgery is the most classic path. It is a 3-year postgraduate degree in which a resident continuously learns in the ward, OPD, emergency and operation theatre. Here, life suddenly changes. Morning rounds, daytime OT, emergency calls in between, case notes at night, and then the next morning the same cycle starts all over again. The first incision is not a heroic moment. Often the resident holds retractors, does suction, applies sutures, and slowly confidence enters their hands. Surgery isn't just cutting. The real skill lies in knowing when to operate, when to wait, and when to refer the patient to another specialty. Now understand the entry of DNB. According to NBEMS, DNB broad specialty courses take place in accredited institutions, and the post-MBBS duration is generally 3 years. DNB General Surgery is also a recognized pathway to becoming a surgeon. The difference is that MS comes from the University Medical College system, whereas DNB comes through the National Board route. A lot of students ask, is MS better or DNB? The real answer isn't hidden in just the name, but in training quality, caseload, faculty, hands-on exposure, and institute culture. If in a DNB hospital the cases are good, seniors teach, and OT exposure is strong, then the training can be powerful. A degree label alone doesn't tell the whole story. In becoming a surgeon, confidence in your hands is very essential. This doesn't come by watching a YouTube video. It is built through real patients, supervision, learning from mistakes, and repeated practice. A general surgeon can manage many cases like appendix, hernia, gallbladder, trauma, intestinal problems, breast, thyroid, and emergency abdomen. This broad foundation becomes the base for future specialization. But the world of surgery isn't limited to general surgery. Orthopedics is the world of bones and joints, ENT is ear, nose, throat, ophthalmology is eye surgery, and obstetrics and gynecology also involve operative skills. While choosing a branch, a student should look at temperament, not glamour. Do they like emergency? Do they like fine work? Do they have the patience for long operations? Anxiety over rank is real. Surgical branches are competitive, and often for the desired branch one has to take a repeat attempt, drop year, or make a compromise. Here intelligence alone doesn't work. Consistency, MCQ practice, clinical concepts, previous year patterns, internship discipline, and mental stamina play a huge role. Getting admission into PG isn't the finish line, it is the starting line of a second race. Thesis, seminars, journal clubs, logbook, case presentations, and exams all run side by side. In the operation theatre, hierarchy is visible. The consultant takes the decision, the senior resident guides, the junior resident observes, and every case silently transfers skill. After 3 years, that same resident has changed. A calm composure enters their voice, clarity enters their decisions, and panic reduces when looking at a patient. If a student went into MBBS right after 12th and did an MS or DNB without a gap year, it can take about 8.5 years to become a general surgeon. But this is just calendar time. Real maturity comes from cases. Even after getting the degree, some doctors keep sharpening themselves through senior mentorship, fellowships, and hospital exposure. Now comes MCH, which many people consider the final surgical crown. MCH means Master of Chirurgie, a super specialty degree in surgery. In branches like neurosurgery, urology, cardiac surgery, plastic surgery, surgical gastroenterology, surgical oncology, and pediatric surgery, the path to MCH or DNB super specialty opens up. For super specialty admission, NEET SS is the national route, which is an eligibility-cum-ranking exam for DM, MCH, and DNB super specialty courses. But for every MCH course, a feeder qualification is required, meaning which MS or DNB background is eligible for which super specialty has to be verified through current rules. There is another twist. Some institutes also offer integrated 6-year MCH or DM courses, which provide a direct long super specialty style route right after MBBS. In AIIMS's INI-CET system, along with MD per mega Siemens, 6 German marks years and MCH 6 years courses are also listed, but seats are limited and competition is extremely high. If you look at the traditional route, MBBS is 5.5 years, MS or DNB is 3 years, and then MCH is 3 years. That means it can take around 11.5 years or more to become a super specialist surgeon. Many students get scared here. They think such long studies, so many exams, so much duty, is it worth it? The real answer isn't found in any salary chart. The answer is found in that moment when a patient becomes stable for the first time after surgery and relief appears in the family's eyes. A surgeon's career looks glamorous, but inside there is very hard discipline. Less sleep, unpredictable calls, possible complications, and accountability always right in front of you. Technology has changed surgery. Laparoscopy, endoscopy, robotics, imaging, navigation systems, and AI-assisted planning have made the operating room much more advanced. But a machine does not replace a surgeon. It can make the surgeon's hand sharper and decisions more informed, but final responsibility still rests on human judgment. When a patient signs the consent form, they don't just trust a degree. They also trust the doctor's honesty, clarity, and confidence. Career options are wide. Government hospitals, private hospitals, corporate chains, medical colleges, trauma centers, super specialty institutes, and private practice. Every place has a different lifestyle and learning curve. Income also depends on experience, city, specialty, hospital setup, and reputation. There can be a struggle in the initial years, but skill and trust grow like compounding. The life of emergency surgery is different. A call can come at night, duty can fall on a festival, and personal plans can shrink before patient care. The ethical burden is the heaviest. Whether to operate or not, how much risk there is, what to tell the family, this is not just a medical decision but a moral one too. Every surgeon sees complications. Morbidity meetings, post-op infections, unexpected bleeding, delayed recovery, all these are uncomfortable yet essential parts of training. Family often asks, when will you become a doctor? But in surgical training, the question changes. When will you be ready enough to hold someone's life in your hands? For kids currently in 10th or 12th grade, the first target is simple. Strengthen your science foundation, understand biology, don't ignore chemistry, and stop being afraid of physics. Even if your English is weak, the dream doesn't end. Medical language comes gradually, but speaking clearly to a patient in your own language is just as important. Motivation videos can get you started, but a surgeon is built on discipline. Reading a little every day, keeping clinical curiosity, and rising back up after failure, that is the real fuel. When choosing a college, don't just look at the building. Patient load, faculty, emergency exposure, OT volume, academic culture, and resident feedback are far more important. Instead of getting stuck in the MS versus DNB debate, it's better to ask about the quality of training. Who will teach? How many cases you will get? How much hands-on exposure there will be? That is what will shape the future surgeon. Even after the degree, fellowships and observerships come up. Extra learning in areas like minimal access surgery, bariatric surgery, transplant, oncology, and robotic surgery can sharpen your career. The hidden cost of this journey isn't just fees. Time, youth, sleep, family events, mental pressure, and repeated exams are also part of this path. But the biggest insight is this: a surgeon is made not by a degree, but by decision making. Before the knife comes into the hand, the mind has to learn the language of patient safety. The roadmap looks simple: 12th PCB, NEET UG, MBBS, internship, registration, NEET PG or INI-CET, MS or DNB, and then if needed, NEET SS and MCH or DRNB. But inside this simple line lie thousands of tiny nights. Sometimes notes in a hostel room, sometimes a patient in the ward, sometimes silence in the OT, and sometimes pressure in the exam hall. Now return back to that same OT where the red light is still burning. The senior surgeon has asked for the scalpel, and the junior doctor has understood that this moment didn't happen overnight. Behind it stands an 8.5-year foundation, numerous exams, countless rounds, and supervised training. If they are a super specialist, it might be a penance longer than 11.5 years. So the question isn't whether to do MS, DNB, or MCH. The real question is, are you ready to keep learning for so many years, take on responsibility, and make yourself better before every single patient?
If this video has taught you something new, or if you feel this information should reach more people, don't forget to like and share the video. Your small share can become valuable and useful information for someone else. If you have any questions related to this topic, or if you would like to share your opinion with us, be sure to write in the comment box. We read every question and suggestion from you, because your feedback inspires us to create better content. And if you want to keep receiving such interesting and reliable information about business, the economy, and the world in the future, then don't forget to subscribe to our channel GRT Business and also press the bell icon so that you get notifications of every new video directly. At GRT Business, we always strive to provide you with accurate, balanced, and reliable information. Our news and analysis are prepared based on information obtained from various news agencies, public sources, and public opinion. We make every effort to verify and validate each fact as much as possible, but in case of any possible error or dispute, the responsibility lies with the respective sources. Our only aim is to present you with a correct and trustworthy perspective so that you can understand any topic better.